Hello everyone, welcome to my YouTube channel Ask Dr. Madhu. I am Dr. Madhu Shankar, Hypertension and Kidney Specialist, Sri Ramakrishna Hospital, Coimbatore. There were a few questions and doubts about my previous video on COVID-19 and kidneys. I'll give clarification on those at the end of this video. And for today's discussion, I have chosen the topic salt, common salt. Right? Do not think this is going to be waste of time. Do not think this is not going to be worth its salt, because I'm sure at the end of this video you will learn few interesting things about salt than what we already know currently. Salt, common salt, as we all know, is a combination of sodium and chloride. 40% of it is made of sodium and 60% of it is made of chloride. We know that in different forms like sea salt, rock salt, powdered salt, iodized salt. Thanks to Government of India's initiative, it has been made mandatory to add iodine to all powdered salt, and that has helped in bringing down thyroid deficiency to a larger extent. Right? So for today, we will discuss under the topics pertaining to history of the salt, the role of kidneys and salt evolutionarily, the role of salt or sodium in health and in disease. Okay? Right. Common salt was not that common. Indeed, it was a rare commodity in olden days. Although salt is known in usage since 5400 BC, Greeks used to offer salt to their gods and kings. Romans used salt as a trading commodity, and Roman soldiers were paid their salary, and a part of the salary was given as a salt. That was called salarium argentum, and that is the origin for the English word salary. Salt has seen multiple civilizations. It is also responsible for the rise and fall of empire. The classical example, Dandi March or Salt Satyagraha, which is an important milestone in Indian independence movement. So how are kidneys and salt connected evolutionarily? Why would a nephrologist talk about salt? Because Stone Age man who used to live in caves survived on around 1 gram of salt in a day. Compare it with the current scenario, we consume to the tune of 8 to 12 grams of salt in a day. So how was this possible? Because over centuries, over years of development, kidneys developed the capacity to conserve as much as salt that is necessary for the body. So irrespective of whether it is 1 gram a day or 8 grams a day, kidneys work and they conserve necessary salt and they eliminate whatever is extra in the urine. This privilege was not available in certain animals. Take for instance elephants. You might have seen the domesticated elephants, when they were given a morsel of food, a rock of salt is added to it. And those wild elephants, they used to search for salt rocks and keep licking them because their kidneys cannot conserve salt. So, immaterial of the quantity of the salt you take, although kidneys function to retain the necessary and eliminate the unnecessary or extra load, still some amount of salt adds up to the body when the intake is more than what is needed, and that is what is responsible for many diseases in the current scenario. The role of salt in health. Sodium is very essential for normal functioning of the cell. Sodium is essential for transmission of messages between cells. Sodium is essential for maintaining normal concentration of electrolytes. Besides, 60% of our total body weight is made up of water, and that water is distributed inside the cell, inside the blood vessel, and in the space in between the both called interstitium. Sodium is responsible for maintaining concentration of water in different proportions in different body compartments. Right? So, what is the role of salt in disease? Okay. So there is a whole new set of diseases called as non-communicable diseases. Unlike communicable diseases like infection, virus, COVID, this disease does not spread from man to man, but it is a result of poor lifestyle or dietary habits. It is a huge spectrum. It involves hypertension, prediabetes, diabetes, obesity, metabolic syndrome, and the common factor of all this disease is excess salt in the diet. Okay, so whenever the salt in diet exceeds the daily recommended allowance, blood pressure increases, and as we have seen in my previous video, high blood pressure is responsible for cases of stroke, heart failure. It is also responsible for progression of kidney diseases. Obesity. It is associated with a group of disorders called as metabolic syndrome, including high cholesterol, and one important reason for that is excess salt in the diet. There are certain group of people whose regular dietary habit includes consumption of salt and spices, and those people are more prone to develop gastric carcinoma. Okay, right. Salt that is deposited in the interstitium alters our disease fighting capacity. It alters our immune system so that the cells which are designed to fight against virus and bacteria fights against our own body cells, and that is resulting in some diseases. For example, rheumatoid arthritis affecting all our joints, and systemic lupus erythematosus called as autoimmune diseases. And high salt in the diet, and hence high salt in the urine, is also one of the predisposing factor for renal stone diseases. Okay, we have seen those spectrum of diseases because of high salt, and the question is how much of salt is too much. So what is the normal permissible daily limit? As I have already told you in my previous videos, 5 grams of salt in a day, which contains 2.5 gram of sodium, which is simply 1 teaspoon, sirf 1 chammach. Anything besides that is literally unnecessary, and that it leads to a set of diseases. Okay, so I hope this discussion was worth its salt. So it is high time we alter or we change our perception about salt. Yes, salt is a very important commodity. It is used for taste, but an excess of it also leads to lots of diseases. So let us always try to make a balance and consume within daily recommended allowance. The discussion about COVID-19 and kidneys, I had told you about the role of ginger, garlic, turmeric and kabasura powder, and also supplemental vitamin C. The point is, you are still allowed to consume fruits containing vitamin C like papaya and guava, but you make sure it is within normal limits. You don't have to consume everything together. You take fruit, you are allowed to take 2 to 3 servings of fruits in a day. Make sure you take 1 fruit in a day, papaya in a day, guava the other day. You can add bell peppers to your diet the other day. And similarly, ginger and garlic within recommended limits, and kabasura powder as recommended by the government and health agencies. Okay, so anything in moderation is good for health. These are tough times, but let us be very confident these times will pass. It may pass smoothly or it may pass painfully like a kidney stone, but I am sure this will pass. Alright, so now we have a topic for the next video. Till then, stay tuned. See you then.